Hello everyone, my name is Kathy Vieira. I will be performing the skills video for IV fluids and medication administration. I will first perform hand hygiene. I will be putting on my gloves. In this scenario, the doctor has ordered IV fluids to be administered at 150 mLs per hour, and he has also ordered amoxicillin to be administered 100 mLs in 15 minutes. So I have gathered the supplies that we need here. So we have our primary fluids. We have our macro drip primary tubing. This tubing is 15 drops per ml. Then I also have here our amoxicillin medication. It's in a 100 ml bag. And then I also have our secondary tubing, and this one's also 15 drops per ml. I also have our alcohol prep pads, and I have the piggyback here hanger already prepared. So we're going to start off with our um, 6 rights of medication administration. So in this case, it's right patient, right medication, right dose, right route, right time, and right documentation. Apart from that, I will also verify with my patient 2 patient identifiers. It can be name and date of birth. I will also verify with the patient if he has any allergies to amoxicillin, and I will also double confirm this with the medication, the MAR from our EMR. I have done the calculations for our medication here. So we will be, for the fluids, it's 150 mLs, and it should be done per hour. So with our drip factor, it's 15 drops per ml, so it'll be 38 drops per minute. For the amoxicillin, 250 milligrams, it's going to be a 100 ml bag to be administered in 15 minutes. With our drip factor, it's 15 drops per ml, so we will be having 100 drops per minute. These are our calculations. Okay, so I'm going to start off by preparing my spike and fluids here. So this is our primary tubing. In our primary tubing, you will find the spike, and pretty much the spike is, it needs to be kept sterile. It cannot be touched. This is actually what's going to be introduced into our IV fluid bag. Then we have our drip chamber. So the drip chamber is meant for to avoid any air to go into the line, into the tubing, and also to visualize our flow rate. So we will be able to check how many drops per minute we have here. The next part is the roller clamp. So the roller clamp is actually what allows us to regulate the flow. I will be closing the roller clamp just because I don't want any of the medication to drip out. So it's in a closed position now. Down, then this is the Y connector. And pretty much the Y connector is meant for any bolus or IV push medication, or also in this case, a secondary line, so piggyback. We will be using this part. We need to verify whenever we use the Y connector that the medication that we are going to be administering, that it's compatible. And the last part that we have here is the adapter. And the adapter pretty much is what is connected to the patient. So it'll be the part that gets connected to the patient's IV site. Okay, so I'm gonna start off by getting my bag, taking off the cap, then getting my spike, taking off the cap, and I will be so I have spiked my bag, and now I'm gonna be hanging it. So when we hang it, it has to be at least 30 inches from the patient's IV site. So I will be hanging it. I'm hanging it on the lower part since I will be having a piggyback. So now the next step is to prime my tubing. So I'm going to start off by squeezing the drip chamber and filling it to at least halfway. Then I will be rolling up the clamp slowly. And the goal is to remove all the air bubbles that we might have in our line. So our primary tubing is now ready. I will be connecting this to the patient's IV site. So I have my IV site here. I'm going to be using one of these alcohol prep pads. And I will be cleaning. And then I will let it air dry. Okay, I will be attaching. Okay, it's connected. So now my next step is going to be making sure that the 38 drops per minute fluid is going to be started. So I'm going to be calculating the drip chamber here, and I will be counting for a whole minute. So we always start off slow, and we will be counting the drops in the drip chamber. So for demonstration purposes, I will be clamping down the rollator clamp. And now I'm going to be preparing my piggyback, so my antibiotics, the amoxicillin. So this is my secondary tubing, and it's pretty much exactly the same as the primary tubing. You have your spike, your drip chamber, your rollator clamp here. So we're gonna roll it closed. Okay, and the adapter. But this adapter will not go connected to the IV site, it will be connected to the Y connector. So first thing is we're gonna be spiking our bag. We need to make sure that our rollator clamp is closed, so it is in a closed position. I will be hanging this one a little bit higher than my primary. Next step is I will squeeze the drip chamber to get it at least halfway full. Okay. So the next step is gonna be getting my alcohol prep pad, and now I will be cleaning the Y connector. Let it air dry. While the connector is air drying, I'm gonna prime the secondary tubing. Okay. My secondary tubing has been primed, and I'm closing it now. My Y connector is clean and ready to be used. Okay. So it's attached to the Y connector now. Now the next step is we're gonna be counting for a full minute. The drops. So this one has to be 100 drops per minute. It's been confirmed 100 drops per minute. And also again, due to demonstration purposes, I will be closing this tab. Okay. So now we have initiated the patient's medication. I'm gonna confirm pretty much if the patient how he's feeling. I will also be monitoring the patient's IV site for any pain or infiltration. Um, since he is in an amoxicillin, we will also be monitoring the patient for any adverse effects that he may have. Um, I will leave the patient in a low position, comfortable, call light within reach. I will clean up all my supplies here that were used. I will be taking off my gloves, performing hand hygiene, and now I will be finishing my documentation regarding this procedure.